let's dive into new and emerging treatment. CAR T-cell therapy has been approved for myeloma patients, and it's certainly a hot topic right now. Can you tell us about this treatment and who it might be right for?
Absolutely. So these T-cell therapies in myeloma are really exciting. And basically how they work is T cells are cells that normally in our body, they're part of our immune system. And when they see something foreign, usually it's a foreign infection or some kind, T cells go into kill mode and take out the foreign invader. And they're supposed to do this with cells that are thinking about turning into cancer. But for various reasons, cancer cells can escape the T cells and then kind of brainwash the immune system to say, hey, it's okay if we coexist with you, no big deal. We'll just hang out together, okay? And that's not okay. Right. And so in CAR T-cell therapy, what we do is we take the patient's T cells, we remove them from the blood with a procedure called apheresis, which is a machine that many patients might be familiar with through their stem cell collections. It's the same machine, and we collect these T cells, and then they go to a laboratory where they are genetically modified in the laboratory using very sophisticated techniques to become myeloma killers. And we educate the T cells to become myeloma killers. We grow them up in sufficient numbers, and then we return them to the patient. We just basically put them back in the patient's bloodstream in the vein, and they go and they are really effective at killing myeloma cells. And that's CAR T-cell therapy. So it's an amazing immune therapy. It's way more complicated than I laid out, of course, but that's the general thought behind it.
And what are the risks of this therapy?
Absolutely. So we have a lot of patients who come and ask about CAR T-cell therapy and think that it's the same thing as getting daratumumab in the clinic or carfilzomib in the clinic. Get it and you're on your way. Far from that. And so CAR T-cell therapy has a lot of risks. And the risks fall into a few different categories. The first risk is called CRS, which doesn't stand for what you think it stands for. It stands for cytokine release syndrome. And this occurs when the T cells recognize the myeloma cell and kill it. And when they do this, a lot of substances get released in the body that can cause a lot of symptoms like fever or low blood pressure or low oxygen. And this requires specialized management to shepherd people through this. Mm-hmm. This almost always occurs in about the first week of the treatment after the patients receive the CAR T cells. In addition, patients who receive CAR T cells can have what's called neurologic toxicity that falls into many different categories. It can be something as simple as a headache or a transient or temporary difficulty, saying words or being confused, or in the most severe situation, even a seizure. So this requires a lot of close monitoring for neurotoxicity. In addition, we know that patients who get CAR T-cell therapy are, for quite a while after they receive the CAR T-cells, at an increased risk for infection. It's very suppressing of the immune system, immunosuppressive. And lastly, a lot of our patients who go through CAR T-cell therapy have low blood counts for a long time. And they have to be monitored for this, might need transfusions or some different therapies. So it's a complicated therapy for sure.